Have you noticed that when you get headaches, your jaw can hurt during or afterwards? Do you find that when you're stressed or anxious, the jaw around the front of your mouth can be really tender? This could all be a sign that you're clenching and grinding your jaw involuntarily. This presentation is more common than you think, and today I'm going to run you through my top 5 tips to manage your jaw clenching and grinding at home. So firstly, it's important to discuss the anatomy of the jaw and how it relates to your headaches and migraines. The main bone of your jaw is called your mandible, which is the bone that connects into the head through a ball and socket joint just about here. The mandible itself is held by a bunch of really strong musculature that help you do things like talking, eating, and drinking. Your upper cervical vertebrae are very closely related to this area as well, meaning if the jaw is dysfunctional, it can lead to problems with the upper cervical spine and vice versa, leading to headaches. The most commonly tight muscles of the jaw are your masseter muscles, which run from the outside of your jaw and into your face, medial and lateral pterygoids, which are much deeper and internally inside the jaw, and your temporalis muscles, which are above and around your ear, around here. When you chew and clench your jaw, these muscles are all activated in different amounts. The muscles can often get really tight when they're being used excessively during clenching and grinding and may require some manual therapy to actually help reduce this tension. Some really great exercises to try at home can be a simple myofascial release. So find the muscles of your temporalis above the ear, around here, and through the masseter around here. It should be quite tender to touch, which is normal. And then slowly open and close your jaw while maintaining the pressure. This should slowly increase the length of these really tight muscles and helps the jaw decrease the tension. Another really good one that can almost instantly decrease jaw tension is doing a jaw jiggle. So all you want to do is open your mouth about halfway and jiggle your jaw to either side, just like this. The more it's done, the more the jaw can get mobilized and can decrease your pain levels almost instantly. The supplementation with magnesium has also been effective in releasing jaw tension, as well as decreasing the frequency, duration, and intensity of the headaches. Magnesium has been seen to help support healthy muscle contraction and relaxation, as well as relieve muscular aches and pains in most parts of the body. Most headache and migraine sufferers, as well as highly stressed individuals, actually need a lot more magnesium and electrolytes than other people, and they need them to help them manage stress. It's recommended that by consuming about 300 to 400 milligrams per day, with many factors influencing the amount required, such as BMI, gender, and physical activity levels. So adding magnesium to your diet may significantly decrease your jaw tension and your headaches and migraines. So jaw clenching and grinding at night is a very common occurrence in a lot of people, and a number of people don't realize they're doing it until their partner or a different practitioner mentions it. Grinding of your teeth at night can not only be painful on the jaw muscles, but can also wear down the teeth themselves. So jaw splints are something that's commonly prescribed from dentists and people that need help with their grinding of their teeth at night. These splints are highly recommended as they protect the integrity of your teeth and prevent the wearing down over time. That'll prevent long-term damage. Although the splints help to decrease the damage to the teeth, they unfortunately might not help the jaw clenching and grinding. But in some individuals they do, so I highly recommend getting on top of that one. The last point, and potentially the most important point I'd like to make, is that jaw clenching and grinding is not always to do with the musculoskeletal system. Clenching and grinding can be a habitual response to stress, and therefore manual therapy can be effective, but it may not solve the problem completely. To get rid of your clenching and grinding completely, a multimodality response is highly recommended with the use of psychological services to help and manage the stress and the reasons you might be experiencing the jaw clenching in the first place. Hopefully some of these tips help you to better understand your jaw clenching and grinding and their relationships with your headaches and migraines. If you're suffering with any of these issues, send us a message and we'll get back to you. Thanks.